bleeding is can be controlled with medications, which is usually given to you by your OB-GYN prior to you even coming to us. So that's a more conservative option. There are also treatments such as myomectomies, where you take out the actual fibroid. Then there's hysterectomy, where you take out the entire uterus. And then there's us, which is a uterine fibroid embolization. So most of the time when somebody is suffering from severe bleeding, the fibroid is on the inner wall of the uterus. And so we're able to target multiple fibroids from our procedure instead of just taking out one or taking out a couple with a myomectomy, which again just means taking out the fibroid itself. The beauty to doing this procedure is that if you don't find that the results are what you were looking for, it doesn't stop you from doing anything else. You know, this is a very minimally invasive procedure. It takes about 45 minutes to anywhere from 45 minutes to an hour and a half to actually target these fibroids. And we inject little particles into the artery that's blocking the blood flow to them. So they tend to shrivel up and die off over time. So again, if it's something that you've tried and you want to move on with something else, a different option, that is fine. However, if you go and you do a hysterectomy first, of course, this is not going to help you. So it's a step. It's a very helpful, rewarding step that definitely gives patients great results prior to doing anything surgical, because it's so minimally invasive. Everything's done through a very small puncture. A lot of times women say, where did you even go through? I don't see anything. And so we do go through a very small artery, either in the groin or the wrist, depending on the doctor. Most of the time it is the groin. And again, very short procedure time, and a very, short time that you're spending in recovery with us. It's anywhere from 2 to 4 hours, but typically it's 2 hours, just because we do have closure devices in order to seal off that artery that we entered through. So it's ambulatory. You're out the same day, a couple hours later, and great results, especially when it comes to bleeding.